Welcome to this video on the key indications for the vasodilator stress test, which uses agents like dipyridamole or adenosine to assess coronary artery disease, CAD, and myocardial perfusion. This test is particularly important for patients who cannot undergo exercise stress testing due to physical limitations or other health concerns. Let's explore the primary clinical scenarios where this test is most beneficial. First, the vasodilator stress test is crucial in the diagnosis of coronary artery disease, CAD. It is used to detect myocardial ischemia, which occurs when certain areas of the heart do not receive adequate blood flow due to coronary artery blockages. This test is especially useful for patients experiencing chest pain or other symptoms suggestive of ischemic heart disease. Additionally, for symptomatic patients, such as those with chest pain, shortness of breath, or fatigue, the test helps determine if these symptoms are related to insufficient blood flow to the heart muscle. The test is also indicated for patients who are unable to perform exercise stress testing. This includes individuals with physical limitations like severe arthritis, peripheral vascular disease, orthopedic conditions, or neurological disorders. It is also valuable for patients who are severely deconditioned or frail, making it difficult for them to achieve the required exercise intensity. For patients with known CAD, the vasodilator stress test is used for risk stratification, especially before major non-cardiac surgery. This is crucial for assessing the risk of cardiac complications in patients with multiple cardiovascular risk factors. The test is also important for patients with chronic stable angina, helping to assess the severity of the disease and guide management decisions, including the need for further invasive testing or interventions. In terms of assessing myocardial perfusion, the vasodilator stress test is commonly used with nuclear imaging, such as SPECT or PET, or echocardiography, to visualize blood flow to the heart. This helps detect areas of the heart that are not receiving adequate blood flow, determining the extent and location of ischemia. It is also useful for evaluating microvascular disease in patients with suspected small vessel disease. The test is also used for post-revascularization evaluation. After procedures like angioplasty or coronary artery bypass surgery, the test helps assess whether blood flow to the heart muscle has been adequately restored. Additionally, it aids in assessing myocardial viability, determining the presence of viable but ischemic myocardium that could benefit from revascularization, particularly in patients with left ventricular dysfunction. For patients with atypical chest pain or other nonspecific symptoms, the vasodilator stress test helps rule out significant coronary artery disease, guiding further diagnostic and therapeutic approaches. It can also be used in evaluating congenital heart disease, especially when there is suspicion of anomalous coronary arteries or other structural heart issues that might impact coronary blood flow. Finally, the test is valuable in assessing left ventricular function, particularly in patients with heart failure, to determine the adequacy of myocardial perfusion and guide decisions regarding potential interventions to improve cardiac function. In summary, the vasodilator stress test using dipyridamole or adenosine is a critical diagnostic tool for evaluating coronary artery disease, especially in patients who cannot undergo traditional exercise stress testing. It is also used for risk stratification, assessing myocardial perfusion, evaluating post-revascularization outcomes, and determining myocardial viability. This test is essential for guiding treatment decisions in a variety of cardiac conditions, ensuring that patients receive the most appropriate care. Thank you for watching. If you have any concerns or questions about whether this test is right for you, please consult your healthcare provider.